Hi everybody, I'm Dr. Roney. Welcome. Opportunity to welcome you, and those of you that have been here before, you know us pretty well. I want to take the opportunity to say hi to Dr. Keneally, special guest.
Hello everyone.
And our very special guest, Dr.
Hi, everyone.
Gama. Yeah, Dr. Maggie Gama. She is, you heard me talk about her on previous cancer conversations, and
I'm here.
Yes, and now she's here live. So tonight's cancer conversation is going to be Dr. Keneally and Dr. Gama just talking through some of Dr. Gama's background. I think you'll really appreciate her background. I think you'll really appreciate her knowledge, her expertise. I would say, I think it's fair to say, one of the top functional medicine practitioners and in the integrative oncology world. Would you agree? I mean, you can be
I don't know.
Yeah, that's what the word around town is. Let's put it that way. So this is what I feel fortunate, between Dr. Keneally and Dr. Gama here, and the other doctors that we have. I don't want to take anything away from them, but there's a lot of knowledge and a lot of experience right here. And when we talk about patient care and patient satisfaction and results, right, it all matters. The execution of it from top to bottom, you have to have good, knowledgeable doctors that have seen what I use the term. I think you all have seen quite a bit, right?
Experience.
And so
Speaks a lot.
when we're working with, I say that this is a little bit of a joke, but if I go to a doctor and the doctor says, I've never seen that before, and then they call in 5 other doctors, you know you're in trouble, right? So here, though, I feel like because of the experience, I think you've all seen a lot. And then when we get our multiple eyes on the prize, right, and we can collectively collaborate, that's where the wins come in. And I feel really fortunate. I mean that wholeheartedly. I feel fortunate that I can refer my friends, I can refer my family in a heartbeat, knowing that they're going to get the kind of care that's some of the top in the world, in my opinion, right? And then again, I'll give you my opinion, but we're pretty familiar with a lot of what's out there. So anyway, without further ado, I wanted to take the opportunity also to let you all know that, thank you for being a part of this. And thank you for being a part of the movement, because as we talk about behind closed doors, healthcare in America has definitely, it's changed, right?
For sure.
It's changed.
Yeah.
And I'm not so sure always for the better. And then the health has also declined quite a bit. And even over the last few years, things have gotten a little bit out of control. Is that fair? We're seeing different things.
Yeah.
We're seeing things start earlier, and we're noticing a change. And with that, the cancer conversation is part of this movement to try to educate, to try to give you information that you all can have to be your best guide and sometimes your best advocate. That if you don't know some of the information as it relates to, say, cancer, and the doctors are, say, recommending chemo or surgery or radiation or immunotherapies, whatever it might be, those things may be absolutely necessary, right? We always talk where we're conservative, I would say, but we're not naive. Fair? Sure. So we know these things may be a necessity, but it's one chapter of a potential 10-chapter book. The other 9 chapters have to do with further testing and doing the right testing and making sure that we're starving the cancer, we're killing the cancer, making sure that we are changing the environment that made it conducive for cancer to grow, whether that's a weakened immune system or low oxygen or high acidity, or the voltage of the cell or the energy of the cell is low, or the nutrition of the cell. All those things matter to be able to change the cell around to make it less conducive for cancer. And then when you get into the causes, right, now you're going down a road of pathogens like bacteria and viral loads and fungal infections like mold or mycotoxins and candida and parasites, and then we get into metals and heavy metals, and my goodness, the list can go on and on. But then you get into the metabolic, right? You get into stress, and that's a big one. Dr. Keneally talks about that heavily as far as the emotional stress related and connected to cancer. And then look at the hormones that are imbalanced. And then the epigenetic factors, which are the gene mutations that start to express and affect pathways of the body. I mean, again, the list goes on and on, gang, but the point I want to make is that movement that we're trying to create via education so you can get the best care possible. And if you don't know the information, then you're kind of stuck in that one cause, one cure, that we're only going to do 1/10 of the piece of the puzzle, the equation. So the cancer conversation is part of that movement, and you being on here is allowing you to learn that. And as Dr. Keneally and I were just talking about, and sharing that, because again, if your friend, family member, somebody you know, you learn this and they go to their doctor and they're just getting the one chapter of the book, they're missing out on optimizing their true potential of healing. And I think that's critical. We were
that's true.
right? We were all just talking about that, that it's so critical to share the information. Not just that if you learn it, you share it. If that means they come here and we help them, great. If that means they can go somewhere else and get really good care that fills in those chapters of the book, I feel like purpose-wise, we've won. We've done our job. So would you either have anything to add to that? I know that's...
No, I think Dr. Roney brought up that we are, and I post, if you follow us on Instagram, we're seeing a dramatic increase in cancers in all ages. So I used to say we had a warranty till we're 40, but now I can't say that because we have 25-year-old, 30-year-old, 35-year-olds with cancer. In fact, the predominant population are young people. And so now we need to be practicing prevention and early detection immediately, not just for cancer, but for all diseases. And our medical system fails at, prevention and preemptive and precise and personalized medicine. And so we have to personalize because every individual is an original. And so we, like I had a patient who, I just saw, and she was diagnosed with breast cancer 2 years ago. And she was seeing us a little bit here at the clinic and being followed by her oncologist in Texas. And she had abdominal pain. And so she was told to go get a workup. And they ordered an abdomen and pelvis, and she had lesions on her liver and pancreas. And so she was doing really everything very healthfully. And so they did a biopsy because when a cancer comes back, you've got to make sure it is the same cancer. So they did a biopsy of the liver, and it's not breast cancer. It's a neuroendocrine small cell. So brand new cancer out of the clear blue, and you're like, whoa, what happened here? So that's why we have to kind of be over vigilant in this day and time, because we're seeing things we never saw before. And that changes here every day. Something new is different every day here, and we're like, whoa, what happened? Why did this happen? And so I think that we all have to be, it's cancer's 1 in 2 people now, and we all have to be practicing early detection prevention, which I think this clinic is the best. I don't know of anywhere in the world that does it as good as we do it. And so, because we have so many more tools now, we have so much more, we have bioenergetic testing, we have liquid biopsy, we have our blood panels, we have so many ways now that we can figure it out. And, an ounce of prevention is worth a pound of cure. So with that message said, if you are listening just because you want to learn from here, this is great. If you already have cancer, you want to make sure that once you get cancer free, you want to spend your time and energy making sure all the time that you're cancer free, and make sure you do your appointments with oncologists and or us. And then anyone out there, you want to educate your fellow family members, your family loved ones, everyone, because this is not, we all affect each other. We're all interconnected. And so we're going to have a better community if we all help each other be the best version of ourselves. So with that said, I just appreciate you guys all being part of our life journey today and always. And but I want to introduce Dr. Gama. I'll let her introduce herself, but everybody, it's not what we do, it's why we do it. So Dr. Gama, why don't you tell us all about your journey and why you got into integrative oncology?
So my background is I was trained in internal medicine and pathology, and I did a couple fellowships in pathology, one in general surgical path, and the other in hematopathology, which is blood leukemias, lymphomas. And I practiced for about 12 years. And then along the way, a couple of things happened. Actually, when I first got into medical school, my mother was diagnosed with breast cancer. And it was actually DCIS, which, currently now the guidelines have changed for ductal carcinoma in situ. And at that time, which was 20 plus years ago, they wanted to do double mastectomy and take all her lymph nodes out, and surgery, radiation, chemo, all of that. And I got a second opinion for her, actually in Tucson, where I went to medical school at U of A, and then they just opted to do lumpectomy and some radiation, and she's been cancer-free since then. So I was very thankful for that, because she could have had a very different outcome for sure if she would have had that extensive surgery and chemotherapy. And then while I was practicing, my father passed away from autoimmune disease. He had Crest syndrome, and basically it's just a horrible disease that can affect different organ systems, and for him it basically got to his lungs, and he passed away from that. But I felt really helpless that I couldn't help him. And he went to Mayo and all the great places where you go when you get sick and want help, and he was put on a medication, kind of a last ditch medication, to see if we could save him. And I think that's really kind of where he just kind of got sicker. So I just at that point I started looking into more other ways to get healthy, and I started taking some classes in functional medicine, and I was just kind of really blown away, because it really is talking more about biochemistry of the body. And when you really get to know about functional medicine and learn it, you can really get personalized, very individual. And that's something I think we don't have today. I mean, you go to the doctor and it's just, first of all, they don't have time for you. So they spend a couple minutes with one symptom, and then they just try to give you medication for it. And our approach is totally different than that. We take a lot of time with patients to understand them, having a lot of sympathy and empathy for them, for sure, because I do see a lot of cancer patients. And my journey then was I basically trained with some docs who were doing more integrative oncology and alternative treatments for cancer. And that's kind of how I got involved with treating cancer patients. So I've been doing that for a little bit over a decade now. And
some of the top ones, right?
Yeah.
Just I want to mention that, because there are some gurus in the country of the world. Dr. Keneally's one, and then there's a group of them, and then you trained with a bunch in that group.
Yeah.
I think that's important to know. So you learn from some of the tops.
Yes. So, and it is, since there is no formal training for kind of doing this kind of cancer care, it is really kind of getting trained from others who have experience in doing it. So I was honored to train with some of the top-notch people for doing what I do now, and I'm honestly honored to be here, because I do agree this is one of the top-notch centers in North America, and I think that we have all the modalities here. Energy medicine is really huge, and we have pretty much everything here to diagnose and treat, and it makes it a lot easier for me, because I can order things that I know that you need as a patient and to get healthier. So, honored to be here.
Yeah, so why don't you talk about, because I think so much of patients, when they find out there's a lump or bump, and then, okay, now we got to do a biopsy, okay? So why don't you talk about what you've read and studied about two different things. One, like the risk of biopsy, and we have our biopsy protocol and all that good stuff. And because patients, say, well, Dr. Keneally, isn't a biopsy dangerous? And then I say, yes, there is potential. And the literature does say that. And that's why we do our biopsy protocol. And then talk about the pathology and why that is so important. One, about getting the correct pathology, but how that really directs the care for each patient?
Yeah, great question.
Yeah, so we do have a subset of patients who, have a lump or bump and they don't want to get a biopsy. And it's really almost impossible to really treat without knowing what you have, because in pathology, there's a lot of benign conditions that present as lumps and bumps too. So we don't want to treat just that with chemotherapy or use modalities that we would for cancer per se when it's not. So it is important to get a biopsy. I think that we have to keep in mind not to be fearful of the diagnostic modalities like a biopsy or a PET CT or anything like that, because it is important to guide our care and to give you the best care and treatment plan for you. So as far as biopsies go, I really don't see that there's much danger in that if they're just sticking a needle in it, or we have to get parts of that tumor for different reasons. My approach is a little bit unique because of my pathology background. I'm really into the molecular targets. So I use a variety of different labs to send that tissue to different labs to make sure that we're hitting everything and not just kind of getting your body systems in equilibrium or in balance, but also looking at everything about that tumor that we can actually attack cancer. So it is very important to get a biopsy so we can identify it and stage it correctly so that we can treat it correctly.
Yeah, I think just to parallel that, I think the benefit, it's always a proposition of benefit versus risk. And a lot of times the benefit outweighs the risk. And one of the things that I'll share you just briefly, a family member of mine went through this dilemma. We know there's possible seeding, things like that, right? So to Dr. Keneally's point, we did some pre-biopsy protocols. And then we also asked the question, well, if it does come back with the pathology, what is our next step? So that way we had the next steps planned. It was going to be a lumpectomy, and it was going to be, and we already had predetermined that based on the research that we did ahead of time. So the biopsy came back in 2 days, day and a half, I think. And then within a week, we had surgery scheduled for a lumpectomy. So we already knew the plan. So that's something that could be done also, that there's a little bit of investigating, and we could always help with that as far as, hey, if you had a biopsy and you're worried about seeding, we could put you on the protocol, but then we can also know the next step if they came back positive.
Yeah.
So things can happen rapidly without the seeding being a factor. I just wanted to throw that in there. So there's ways around it that pragmatically we can really help help your psyche.
And I think too, what can be pretty significant is I've treated a few patients that basically were treated outside and conventionally, and then they were told that there was basically they had a few months to live, and we actually got the tissue from the original biopsy, which could have been like 5 years or later. They usually hold the tissue for about 10 years. And so one gentleman in particular, I remember we got his tissue, and so one of the molecular targets is PD-L1, which is the medication or immunotherapy is Keytruda. And we basically got Keytruda for him. It was kind of used off-label because it wasn't, at the time, it wasn't used for his type of cancer, but we used it, and he's been in remission for several years now. So some of these things can be life-changing, and it's just getting to the right people who care about you to do the right thing, to do the right testing, can be a real game changer.
And to use that information, wisely, like you were talking about. So, Cancer Center for Healing, we talk about this each week. I'll go back at the end if you're okay, and I'll clean all this up. And then I'll give you, I do want to talk about this each week. I really like to talk about the early detection and human optimization program that we have. I think it's critical in this day and age. And I always say, even personally, supplements, workouts, my diet, I've done that for years, but I actually am taking a much deeper dive now because of what we've seen over the last couple of years. It's not enough anymore. We have to go through these extra steps to find out about toxins and molds and chemicals and things like that. So I'll come back to this at the end once we get through everything, because I know Dr. Gama is on a time crunch. We talked about the 4 pillars a little bit, and then we talked about your education background, mother's journey, right? Specialized training. Boy, we're hitting this. We're doing good. We're hitting it out of the park. Okay. Anything else that we didn't cover that you would like the viewers to know about your approach? Or I think it's critical that the pathology part, I think, is another level here that I think is outstanding.
I mean, you know, in addition to kind of like, as Dr. Roney was explaining the pillars of health, I think he mentioned that earlier about, you know, infections and inflammation and toxins and all of that. So what I like to do is actually look at your pathology report, because as a pathologist signing out cases, there may have been something in the background, like inflammatory cells or granulomas. There's different things that once we see cancer cells, it's just a diagnosis of cancer. So everything in the background is just kind of forgotten about. But I think that was so important. And as a pathologist signing out cases, it was hard to get to the primary care doctor or the surgeon to let them know, because obviously we just, you know, we have in conventional medicine, we just have a formula for treating. So we don't really care about what's kind of in the background of things, even though that could help you. And so I take the time to look at the report for the background cells to see if there's something that we're missing. For instance, I can say just recently, 2 weeks ago, there was a patient that I had that there was granulomas that were seen in his biopsy. So we're looking into that and actually treating that, because that was something that was in the background that just kind of got missed. And we do see granulomas in the face of various infections. So those are kind of the things that I think that maybe
more targeted.
Sorry. More
If
targeted.
you can get more targeted. Yeah, sorry, I didn't mean to interrupt.
And just kind of focusing on that more, along with all the other things that we do.
Love it. Yeah, I think that to your point, individualizing the care as much as possible, using the data that's in front of us, right?
Right.
Yeah. All right, so Q&A, let's see. We'll start with these, and then we'll go into the Q&A at the bottom, gang, and we'll get to as many as we possibly can. If you can only afford a few extras, assuming diet is already clean, you're exercising, you're taking supplements, which integrative treatment would you add on to prevent cancer recurrence? Hyperbaric oxygen, vitamin C, sauna, etc. And I'll let you both tag team on that one too.
Well, probably the most important thing that every patient should address and continually address is stress in our life. I think stress, I mean, I've been reading about stress for the past 27 years, I think. And read one thing, and then that led me to another, to another, to another, to another, to another. And so that is something that you can't address by yourself.
It's hard.
You can't be objective about yourself.
Sure.
You have to have a person who's objective, who has expertise, because like psychotherapy is not what psychotherapy is anymore. It's now transcended into so many different things that you can do. And so you want to make sure that you really partner with that person or that technique or multiple techniques to really, and then maybe get a reboot, a year from now, because, as you know, life is not a straight line, and we get curveballs and detours on a regular basis. So I would say stress, I mean, I've been talking to patients for 37 years.
Yeah, right.
And I would say, that's not anything I learned when I went to medical school. I mean, I learned like ECT and medications, okay?
Right.
I didn't learn that stress was anything part of your life,
right.
Okay? And then as, my career and practicing, and then
See it live every day.
Yeah, well, and also I have my own stress.
Yeah, right.
And so having my own stress, I went, okay, what do I need to do? And then that led me to this endless track of constant learning, and I like to experience. Like this week, Thursday, we're going to have a vibrational healing. Well, I can't wait, because now it's going to be time for me. I'm going to participate just like the patients. And so any opportunity that I can for healing, I do. And so if I need to do it, you need to too.
Yeah.
So I would say addressing your stress on a continual basis and doing it with an objective person, but then, You shouldn't have to be able to, you shouldn't have to have someone babysit you all the time. So you need to take the tools they teach you and how do you apply them on a daily basis with gratitude and deep breathing and solfeggio frequencies and all that kind of thing.
Yeah.
And really master your self-care, like your sleep, your water, your eating, all your self-care. And like sauna, I would say sauna is probably the single best investment you can make in your health, because we live in a sea of toxins today. Sauna is good for oxygenation, it's great for EMF, it's great for detoxification of toxins and heavy metals and everything. And then after that would be maybe an IV vitamin C. If you know the work of Linus Pauling, he was, and there's so many studies on vitamin C. So an IV vitamin C as well as oral. And then for sure, pancreatic enzymes, I think are an important part. I mean, I've read the work of Professor John Beard and obviously the late Dr. Gonzalez. But I think taking oral C with pancreatic enzymes are very, very important. And then make sure you are touching base with an integrative functional doctor who can look at your blood tests, do the bioenergetic testing, do some other testing. I think would be a great idea.
Clean up the environment.
Yeah, and so what do you think, Dr. Gama?
So I think all of that is important and necessary. If I had to pick one thing, because I know, a lot of patients that kind of take this route, there's so many great things that you could be doing, right, continually. And, if we could, we would. But if I had to pick one thing that's been sort of researched recently would be high dose vitamin C for cancer stem cells. So if you're in remission right now and you're okay, what's one thing that I could do? I would probably choose the high dose vitamin C. There's been a couple recent studies, one at University of Iowa who researched the effects of high dose vitamin C on tumor stem cells. And that's really kind of what we're trying to target, because when you're in remission, we can't see anything on PET scan. And if we do a Signatera test or other testing for circulating tumor cells, hopefully those are 0 or 1, anyway less than 2, then we have to kind of focus on that, on the stem cells. So stress, as Dr. Keneally mentioned, is big, obviously. And then I would probably just do high dose vitamin C 2 or 3 times a week, and just continue active surveillance. That's super important, because the first year that you're sort of in remission is super important. So you need to keep following up with whatever clinic you're going to.
That's where I feel like we do a great job now, right?
Yeah.
So I'm sorry to interrupt,
No.
but our surveillance is probably top, because we have the liquid biopsy, we have the tumor markers, we have the Signatera, the Dataras now, we have the Guardants, we have all those in our toolbox. Again, plus the Nagalases and the PHIs and the D-dimers and all these different lab markers that equate to maybe 10 different data points.
Right.
Yeah.
Now,
I want to say
least.
one other thing. So I was getting ready for work the other day, and I saw on the news that they were talking about treating children now with sort of targeted chemotherapy. So they had shown a child who had leukemia, and they had sort of exhausted their chemotherapy, and he had relapsed, and they sent it out for studies, which we're actually doing here now with a certain lab, and they're personalizing the chemotherapy. So we're already doing that here, but that's very targeted, personalized treatment. So that is kind of getting either blood or your tissue to kind of see what the sensitivities are for different chemotherapy agents. So that's really, I think, really important.
Yeah, I agree.
Yeah, and chemotherapy, and well as natural things,
And natural
repurposed
therapies,
drugs,
all of
the
those.
whole gamut.
It all
Because there's so
matters.
many studies now on all of these things, natural substances, repurposed drugs, the chemotherapy. There's just so much now that's showing, the scientific validation. So
That's where I love the plan that we have when it comes to, and you hear me say it all the time, but when you look at starving the cancer, and you look at killing the cancer, and you look at changing the cellular environment of the cancer, and then you start working on causes, my goodness, it's like you just simply maximize your upside if your I's are dotted and T's are crossed. And I feel like that we do it as good or better job than anybody out there. So that's what I like. And even personally, having had, a form of cancer years ago, when I learned this plan, the peace level now of I'm at peace, where for years I was like, whoa, you're on edge, just worried about it, even if you're healthy as could be. Now you get this plan and you're like, oh, I'm doing this, I'm doing this, I'm doing this. So I feel like that's where a lot of the peace and the serenity from a healing standpoint can come
that's
from,
a good point.
when you're dotting all those I's and crossing all those T's. So I did have a question for both of you. So the testing, because part of the stress, right? Part of that testing is also the cortisol, seeing what the cortisol is doing, because there's the sympathetic response where it's high, and then there is something called adrenal fatigue where your gas in the gas tank goes down. And some of the testing is not good to pick that up, right? But then you also see what happens hormonally as a result of that cortisol. So what testing do you like, and what do you like, Dr. Pino, if you don't mind me asking?
Right. Well, if you want to talk about the cortisol, you can do a early morning cortisol to look at that. But as we know, cortisol has a diurnal variation.
Right.
So saliva cortisol, because your cortisol is high in the morning, a little bit lower at noon, a little bit lower at 4, and a little bit lower until it's very low at night. So you get that diurnal rhythm of the cortisol, and your DHEA. You need to be checking both. So, but a blood test too, because there was a book, I forget what it's called, like adrenaline something, about people's cortisol being high in the morning. If you can test that first thing in the morning, because as people are stressed, their cortisol's through the roof.
Yeah.
So a combination of those two things I like. It's hard to check someone's blood 4 times a day.
Well, yeah.
So the saliva cortisol. Then you can do also a 24-hour urine.
Well, that's like a Dutch or
like
something
a Dutch,
like that. And I know
yes.
you have your go-to, right, Doc?
So I like, there's a new test that came out in December called a HUMAP test, and it's HUMAP. And what it does is especially for women with breast cancer, it will test sort of the bad metabolites, the bad estrogens. So there are
2, 4, 16 hydroxys, right?
Yep. So there are some pathways that estrogen can be metabolized or broken down into that can actually kind of feed cancer, if you will. And so I like to see what's going on there, because there are things that we can do with that pathway. And on that note, I'll just mention quickly about methylation genes, because I'm probably one of the few doctors that do routinely test for that. I know we all do here, but outside of here, I think it's so important to test to see if you have any of the methylation genes, because they do matter. It matters in your ability to detox, including hormones, including female hormones. And we live in such a toxic world that I think that's why we're seeing a lot of earlier cancers as well. So testing for those genes, there's various ways to do it. You can do like a cheek swab. You can get a blood test. And those genes, you probably are familiar with the MTHFR gene. But there's also 4 other genes implicated in that whole pathway, and they all matter, and they all kind of compound on each other. So I like to get the whole pathway so that we know exactly, kind of what we're dealing with genetically. And I find that most people, unfortunately, that do have cancer, they have multiple genes involved there, and that's why it's so important, because I rarely get one that's like they don't have any genes implicated. Right. So I know just from experience that it does matter.
And Dr. Gama has a good point, because at least 50% of the population has these methylation problems. And so how you're making your DNA every second is impaired.
Right.
And so it's like very foundational and critical.
At the top of the food chain, honestly.
So
we're upstream in that person's care.
And not just with cancer.
Right.
With everything.
Everything
that you put in your mouth. Everything that goes in your mouth has to.
We should do a cancer conversation just on that.
We should.
And do the testing, and everything, and then the things that how we fix it, because you don't fix it with medication, you fix it with supplements, believe it or not.
And you have to identify. You can't fix what you don't find.
Right.
So you have to learn, what that looks like as far as the right testing, and then what to do with it when you find it. And one of the things I was reading not too long ago was that in this day and age, these genes start to express themselves like the MTHFR because of all these things we talked about on the cause side. So environmental factors, stress, toxins, chemicals, infections, right? Life that we're exposed to now. So these genes are basically turning on or expressing more and more because lifestyle is getting more and more out of hand, if you will, right?
Yeah.
So now, more than say 50 years ago, if you will, we're all born with these gene mutations. It's a matter if they start expressing, right? And the expression, Dr. Ben Lynch talks about this a lot, that they get dirty because of our lifestyles. And I think we're seeing more and more implications of these genes, these epigenetics, because of the lifestyle. Would you all? I read that. I thought that was a good theory.
I think that just some people just genetically we have them. They're called SNPs, or single nucleotide polymorphisms, and we all have them. But what's very interesting is that we're personalizing medicine so much that, you know, we there's places where you can get your blood drawn to actually figure out what SNPs you have. So they could be SNPs for anything really. Like if you have Achilles tendonitis, you might have a SNP for that, saying that you're more prone to that, or that you can't process sulfates very well, or, you know, and maybe that's why you have more allergies than another person. So you can actually do that, and that's really getting really personalized with your genetics, what SNPs that you have that are implicating, you know, and affecting your health. And that's just one piece of it, the MTHFR gene, the methylation detox pathway, that we can do things here to help you with that.
Right.
And I think it's significant.
You're
Good?
going to take the next
Yeah,
question.
sure. Do antioxidants such as algae supplements interfere with chemotherapy and radiation?
No, I mean, algae, we're talking about spirulina and chlorella. No, they're an adjunct. In fact, I just read an article on that today. There was an article about how it's very beneficial doing chemotherapy and taking spirulina.
Right.
And these are foods. So these are foods that have a high amount of protein and nutrition and really also help you cleanse and, you know, and protect your body. So
I think this is a big one because we get this question constantly where on the conventional side, and I get the theory, but the conventional doctors say, look, we're doing chemo, we're doing radiation, we're trying to kill these cells. We don't want anything to protect the cells, right? So that's the general, right? That's it. So there's that line of, okay, well, what is that line, you know, and that's a question. What do you think about that, Dr.
So
Garland?
I think it is a common misconception, but it's really what we learned conventionally, right? Because we don't know what an antioxidant versus pro-oxidant versus an oxidative therapy. We're not trained that way. I mean, I learned it because I do what I do now.
It's all the same, right?
But
it's all the same.
so you know, just to protect everybody, you're like, oh, you know, don't take anything with an oxidant in front of, you know, in the back side of the word, because they don't really know. So, you know, things like, you know, like algae supplements, that should be fine because, as Dr. Keneally said, they are protective. But, you know, it really has to do with dosing, I think, is really kind of the missing link for that. So things like high dose vitamin C, like ozone, things we do here, they probably wouldn't be recommended for radiation therapy for that reason. But antioxidants should be fine.
Now, having said that, like high dose vitamin C, the way I understand it, the way I read through the Reardon protocol and the research, was that high dose vitamin C, because cancer cells lack the catalase enzyme, actually converts potentially into hydrogen peroxide, which makes it a pro-oxidant. So it makes it as a benefit, but you also get the immune boost from it, which is, so you almost get a dual positive effect. I want to be clear because that's what
I think you're clear, but it's going to be hard to get that clear to people
them.
Getting that.
Oh yeah,
because
for
they're definitely not gonna. Yeah. But you're right. I mean, you're absolutely right.
So there's a doctor out of, I think he's Memorial Sloan Kettering, and I have it on my template. And his name is Dr. Simone, and he's very into health, and he's a radiation oncologist.
Yeah.
So he did a whole paper. So we can send it to all the participants about it. But he did a really good, amazing paper because he is all about health. But he's a radiation oncologist, and he talks about antioxidants are not bad for patients receiving chemotherapy or radiation. So
I personally think it's so strong. I don't know how these things are going to overcome some of that. I call it an atomic bomb, but that's just my general thinking. But I'd love to read that.
Science changes, though. It's an ever-evolving, dynamic process. So it's like it's so fascinating because when smoking came out, people didn't think smoking was bad.
Yeah.
And we actually knew in 1923 by a German pathology professor that smoking wasn't good. But of course we kept doing it.
Sure.
And so we have to learn from these
Yeah,
past
right.
things,
That it's
And
evolving.
It's evolving all the time.
Yeah.
So
Do you recommend a biopsy to confirm a DCIS diagnosis? Also, what are your DCIS treatment recommendations? You were talking about that
Yeah.
earlier,
So yes, I do. I mean, that's the only way you're going to really sort of confirm DCIS, because when you get a mammogram, they'll see calcifications that's really kind of the biopsy area. That's the area of interest. So it is important because, they have done some restaging on DCIS, which is ductal carcinoma in situ. So it's still within the duct, the cells are looking ugly. So they're not really cancer cells yet, but they're impaired, let's just say. And that's why we do the things we do here to kind of help that sort. There's usually a reason why. So if I were to see you for a diagnosis of DCIS, I would kind of ask a lot more questions about, just breast health, your general health. And as far as treatment recommendations, the treatment recommendations, there actually is new research out there recently from UCSD on metformin. Metformin use, which is what we use as one of the off-label use, and DCIS. So that's kind of a promising off-label use for that. What else for DCIS? Just getting kind of learning the systems like your methylation pathways. That's a big one that I find also people have methylation gene issues there that I just spoke about. So understanding that to see if you have those genes, and then doing detoxifying your liver, detoxifying estrogens, checking a HUMAP test to see. So the HUMAP test tests for cortisol, and it also tests for your urine hormones. So I think that's probably one of the better tests for testing hormones, the urine, then salivary, then blood. So we can kind of see where your levels are. So kind of getting all that back in sync is a good approach for preventing DCIS to go into cancer.
Good doc? You
Yeah.
good? Yeah, it's pretty. All right, cold plunging or hypothermia good for cancer immune support? These are my favorites.
Go ahead.
Yeah, no, I mean the research on cold plunging, hypothermia, or even sauna, right? They talk about these adversity genes,
Right.
and the adversity genes in this world that we live in, based on everything that I've read and studied, they don't get turned on as much because we're comfortable, right? Mm-hmm. So fasting and doing, whether it's intermittent or a multi-day fasting, puts our bodies in a state of adversity. Or if we are, cold plunging or doing sauna, we're actually invoking what they call the heat shock proteins or the cold shock proteins. And these are adversity genes that actually protect the DNA of the cell. So that's what I know about them. That's why I use it personally, and I think it's made a huge difference for me personally. But do you all have any insight at all?
Yeah, I love the cold plunging. I think it's great. Ice baths.
Yeah.
A couple of our staff do the ice baths or go in the ocean in cold. Even if you go do your shower, like just for a minute, there's something called hormesis, and a little bit of a bad thing is good for you.
Yeah, right.
So, so it helps the body to be resilient. Mm-hmm. And so cold plunging, we know, and it's great for stress. It's great to get your HRV, your heart rate. Mm-hmm. It's very good for that.
Even sticking your head in an ice bucket,
yes.
like a little bowl of ice, right? Just sticking your head. They've done studies that it reduces the cortisol load, yes, and it reduces the sympathetic response. Right. Get you back into what they call parasympathetic, which is rest and digest. So it's a good one.
So so definitely do your cold plunging, however that looks like to you.
I have a funny story. So I do cold showers now all the time, and I was back east at a wedding in Pennsylvania, and so my shower here and the cold water there are two entirely different. I thought I was doing well. I'm like, oh, I'm crushing this. I get back there and the water was so cold. I had a headache and everything else. And it was, but I'm like, man, I thought I was so far ahead and now I have work to do. So I always tell the story. I'm like, oh my God.
Humbling.
It was very humbling.
Yeah.
That's exactly right. So, okay. All right. So how do you feel about wild yam cream to alleviate hot flashes in breast cancer patients? Good question. Dr. Simmons had some good information on that. Jen Simmons a couple weeks ago.
Yeah.
As far as using the natural progesterone.
Progesterone cream, yeah.
Mm-hmm.
Using the natural progesterone cream because it downregulates estrogen receptors. But
there's a lot more to that.
There's a lot more,
probably, yeah.
yes, to it. But if you do have hot flashes, because there are some things that can help with hot flashes. But I will recommend either a progesterone cream or a time release progesterone for patients. Also, sometimes a little pregnenolone can help with the hot flashes. You just got to check your estrogen levels to see if the pregnenolone possibly even goes into estrogen. So we're always keeping track of like what is all the hormones, what's the hormonal cascade look like. So you've got to, and everybody's different. No two people are the same.
That's it. Yeah. So the general is, hey, you should probably be with somebody that's looking at all the pathways.
All of it.
Like Dr. Gama said, even looking at the metabolites, right? Mm-hmm. They have the progesterone metabolites, the estrogen, estradiol metabolites. It's probably a good idea to get a nice view of that, and then have a provider be able to guide you properly through that, because not all the time across the board, right? Would you agree that it's the best thing? But a lot of times it is.
Different.
That's right. That's where the individualized medicine comes in, for sure.
Exactly.
Hodgkin's lymphoma, and have been getting a lot of UTIs and a kidney infection. My doc wants to put in a port and give me immunoglobulin infusions. Good idea, question mark.
Well, first of all, have you been treated for the non-Hodgkin's lymphoma, which is very successfully treated with chemotherapy? But again, you have to change the garden and the terrain that the cancer came in. Now, if you have recurrent UTIs, you don't want to be taking antibiotics recurrently because you're killing your microbiome every time, not to mention mitochondrial effects of the antibiotics. And you're going to have the risk of developing resistant infections if you have recurrent use of UTIs. So what we do for that, first of all, I don't know if you're male or female, so I need to know that part. So you probably need to give us some more details. If it's a female, we got to make sure, checking your hormones, because if your vaginal tissue isn't good, then you're going to have an increased risk of getting a urinary tract infection. And so what we do here is I give the patients something called cran mannose, which is a combination of cranberry and mannose, which helps prevent. So you don't want to treat the infection, you want to prevent the infection. So if you have an infection, we will use either cranberry or mannose or iodine for urinary tract infection acutely. But for prevention, we'll have put you on cran mannose. And sometimes I have to give kidney support, like kidney chi or guna kidney, to make sure the kidney's doing the proper work and purification. Immunoglobulin, first of all, your doctor should be checking your immunoglobulin. So I would do a panel of all your immunoglobulins, IgG, A, M, D, and E, to see if you really need that. You can take oral immunoglobulins by taking IgG or colostrum, which has a great supply of all your immunoglobulins. So I like to give you IV immunoglobulins. That's a pretty, first of all, what is the source of these immunoglobulins? So you need to make sure the source of these immunoglobulins are good, and because they come from a donor, so you don't know about the donor's, history and everything. So I'm a little bit more careful and cautious about that. So I would be doing the prevention of the infection, and then why are you getting these infections? So I don't know why I don't know if you're male or female, and Dr. Roney brought up the possibility it could be yeast infection. So so you just got to do the right thing for the right problem, but you got to get down to the why, where, when, and how. There's always a reason why something's happening.
Yeah.
Good answer.
Yeah, right.
Yeah.
And when new patients come here, just so you know, we have a series of testing that they go through automatically.
Right.
Right. And these automatic tests are based on experience of knowing, hey, we see these things commonly. We want to make sure everybody gets tested for it. Again, there's a system, there's a method to the madness. And then they meet the doctor, and then the doctor does the additional testing. But there's a series that look at a lot of, whether it's candida or parasites or fungi, just a lot of different things that we want to get out of the gate right away because they're so common. This is something's going on there.
Yeah,
obviously.
so you have to get to the bottom of it. I know in my experience, because this happens to females more than it does males, because anatomically the distance from your urethra to your bladder is very short in a female, and so so it's something that can be fixed really easily. But again, we have to identify like what is causing this and fix the problem. So giving IVIG, that's like, that's pretty big.
It's aggressive.
Yeah,
That's a very aggressive.
Aggressive.
So
Aggressive.
I don't know. That's just my two
right,
cents,
right.
because I have recommended patients get IV immunoglobulin, but very, very unusual situations. So you need more of a workup and more of a targeted treatment, and get down to what are all the contributing factors to this recurrent UTI.
Something like this, I tell the patients all the time that might be the go-to, but we really should do a lot more vetting to be able to identify, more and more things, or rule them out. And then it's like, well, maybe that's the last resort.
Right.
I don't want to say that it is the last resort, but the point I'm making is there could be a lot of things done ahead of time.
Yeah, exactly. There's way more could be done before you get to there.
Yeah.
Agree.
Okay, go to the next question.
Yeah. We'll do one more, and then I know you have to go, Doc. All right, what is the best way to get rid of a low-grade, slow-growing tumor that surgery couldn't remove? Well, you go back to Seafried, and you talk about slamming the glucose and pulsing the glutamine.
Yeah, and you just need an evaluation by one of us to, if a surgery didn't remove it, then, and you're not a surgical candidate, so you need to do some, checkmate.
Starve, kill.
Yeah, you got to do some things to get your body in checkmate.
Yep.
So
causes.
So,
really the 4 pillars.
Yeah, so I don't know, and I don't know what, this is, very superficial question, so we need more detail. So, but that would be best for.
It could even be a benign tumor.
Right, exactly. So,
low grade, slow growing.
Right, yeah, exactly.
Could be benign too.
Yeah, so, and you might have a second look at the pathology, right? So,
Yeah, a lot more to that one.
Yeah, a lot more.
Okay. All right.
What else, Dr. Ronnie?
Yeah, we'll do. Let's see. Thoughts on cancer. A couple of patients actually had this come up over the last couple of weeks with their cancer. So, anybody?
Yeah, go ahead.
You go first.
So, histotripsy is something kind of fairly new. We've sent a couple patients for that already, just for basically for liver mets, and it's kind of targeted treatment to the liver specifically. Where they can do targeted treatment to get rid of the metastases to the liver. And there's certain protocols that they have to do also, right, for kind of getting a patient ready for that. And not everyone is a candidate for it either. So they have their own criteria. I'm not sure what they all are at this point, but checking with a radiation oncologist, they can help you with that to see if you're a candidate for that. But I think if you have colon cancer with mets to the liver, that's definitely a good treatment. And we'll see. We don't have enough experience to kind of see right now if it's...
Is it new? That's what I was going to ask, because I've never seen it until recently.
Yeah.
Right.
So I that's ignorant, I know, but I haven't.
It's
is
new.
Then. Okay.
Yeah.
It's new.
We're just starting to do it here at one of the hospitals.
Right here in Mission VA.
Okay.
But again, it's new. Just like we do, a lot of us here do a lot of new innovative things, and we've done intratumoral ablation with different things, but these are new frontiers, and they may be miraculous for someone and then not be
so true.
miraculous. But again, that's just one of the 100 steps.
Right.
So, everybody kind of thinks and treats the body like it's just a 1, 2, 3 punch. Unfortunately, the miracle that we all live in is very mysterious, it's very complicated. Lots of moving parts, and you don't live in a petri dish. And so we've got to do, you have to do all of it. You don't go to a car dealership and buy part of a car. You buy the whole car, okay? And so your body is a jillion times more complicated than any car. And so this is what we have to really understand.
And that's a super good point, because when you look at histotripsy, we're just treating tumor in the liver, but we're not treating liver toxicity in general. Like if you have a toxic liver from methylation issues, let's just say, maybe that's why the cancer is going there in the first place, because it's kind of a weak link to get there. So you're absolutely right. I mean, you can't think of it as just an isolated treatment. It has to be the whole thing.
It would be one chapter of that 10 chapter, 20 chapter book, right? And it might be a good chapter, but there's other chapters that we want to fill in the blanks with too.
You might get rid of that tumor there with histotripsy, but it may come back.
Right.
So that's why you want to kind of make sure that
Do it all.
you're doing everything. Yeah.
Your terrain and the garden that the cancer came in.
Yeah,
So,
absolutely.
It's a common theme, isn't it?
Yeah,
It's
it is a common
We
theme.
talk about it all the time.
Well,
Y'all
it's just,
hear me.
we can apply that principle to any disease. You don't just wake up
No,
and have a
agreed.
heart attack.
No, right.
You don't wake up
right.
and have autoimmune disease.
right,
You
yeah.
don't wake up and have any disease. There is a negative forces or many negative forces that have caused this situation, and we've got to get rid of everything that's creating the perfect storm.
Agree.
Agree.
All right.
Yeah,
So we
very
will end on that note. Dr.
Okay.
Gama had a cold stop, a hard stop. What do they call it? I don't know.
Hard
Hard stop, cold stop. But she had to be out by 6. So
Yes.
we'll
It was
definitely.
nice to meet
there
everybody.
you go. We want
And,
to say thank you to Dr. Gama for being here. We love having you here. So and the patients, I think, again, more with people like Dr. Keneally and Dr. Gama and the staff that we have. I don't know. I just think it's one of the best out there. I mean, you have some of the brightest minds in the profession, like ever, right here.
Right,
Like,
right here.
Man, it's
We're lucky.
we're lucky. Yeah, very, very lucky. So we'll take this opportunity. What I'll do, I'm going to let you go, Dr.
Okay.
Gama, so you can
Yeah.
roll. You said it all the time. There are just things that are happening at an earlier age, at an earlier rate, more aggressive. I mean, we've all seen it here.
Right.
So the preventative part is our way of trying to make sure that we're not just seeing people on the back end when they already have, a quote unquote chronic disease.
Major diagnosis.
Yeah, major diagnosis, that we could start looking at it on the front end. And all these things that you hear me talk about that I do personally, this is part of it. Not too long ago, oligoscan, I saw Molly with the bioimmune, and I'm just following down here, gang. The blood microscopy, the F scan for looking at parasites and different digestive, things that could go on based on that frequency. Heart scan, the Cologuard for instead of doing a colonoscopy, we could do the Cologuard. And then, of course, the blood work that we talk about all the time, whether it's a blood count and a metabolic panel looking at kidneys and liver and things like that, and glucose. You look at your iron levels and ferritin and hormones and inflammatory markers and lipid panels and vitamin Ds and homocysteines. I mean, we can run blood that insurance covers typically, correct?
Right.
That can really get a good picture of what's going on from top to bottom. And then these other scans that I already mentioned, that we have all the chronic disease like a cancer patient go through, because the data that we use is on the energy level, right? If we use testing on the energy level, it's going to pick up things much more sensitively than, say, blood, urine, and saliva. Is that fair?
Right.
And then we use blood, urine, and saliva too, and then we use the scans. So if we're using all of those, am I right in saying that scans sometimes, even though they're necessary, won't pick up things until there's a percentage of change?
Right.
A lot of
and
times,
it's just the biophysical part of you.
Right.
So it's not, we have to look at
All of it.
every
Yeah.
facet of the human frame, which is the bio-spiritual, the bio-emotional, the bio-intellectual, the biophysical, the biochemical, and the bioenergetic. So all those levels, if you're doctor, I mean, that's, the definition of health, you know. And so if we're not looking at all of these facets of the human frame, then we're not properly taking care of you. And the medical profession, unfortunately, we're about 20 years behind, and the medical profession has a reactive approach. You get a diagnosis and you get a drug. We're trying to de-diagnose you.
Yeah.
Okay.
Right.
And so you want to come here to not have a diagnosis, because doctors get paid on diagnosis. But we're trying to de-diagnose you so you have a clean slate, that you don't need the medical, paradigm that we have today. So
If would you say, fair to say, if they spend a day or two with us, right?
Oh, yeah,
Consult daily.
yeah,
Like this
you
is
would know,
an easy one.
Yes,
And
you would know everything.
that's not a sales tactic, gang.
No,
That is us saying, listen,
You would be saving your life. You know, I
scared straight.
Yeah, I had a patient today, you know, or yesterday it was a glioblastoma, and I was like, oh gosh.
Saw him today. Yeah.
If we could just prevent these patients, it would, gosh, everyone's life would be spared. I mean, it's like, because he has 2 children, and he has his work, and the work, he's been working for 20 years. They're like,
Good
okay, give it the
purpose.
time, and then give your time off, but you know, you don't want to spend all your time off taking care of a disease that could be preventable.
Prevention
So,
is always easier than the cure.
yeah,
right?
it just is. It just never sells, because I've been
I
talking
know.
about
No.
prevention for a very long time. But I tell people, like, isn't what we see enough?
Yeah.
Isn't
Yeah.
it enough
Yeah.
that we all need to all take charge and inventory of our personal life and say, what do we need to do to optimize and get healthy?
I agree. There was something I read not too long ago where the hierarchy of needs, right? You know, that psychological chart, I guess, and it's food and shelter and things like that. Health was like 12 or
wow.
10 or 11 or something like that. But then aesthetics was food, shelter, aesthetics.
Oh, no.
You know,
No.
we know these things.
Form
So-
over substance.
Yeah, exactly.
very
So
sad.
it was, and that was years ago. It may have boosted up. Hopefully, it boosted a bit. But the point I'm making is, you're right. A lot of times we don't start acting until there's a crisis,
Right.
and then it's like, oh my gosh, then we're just peeling back layers and layers of the onion. I think you get the point, right? So something like this gives an opportunity to make sure that you're investing. I always say investing, not spending. Investing some time, energy, and money into your health that you could identify early on using the energy type of work, using the blood, the urine, and saliva to make sure that we're seeing something develop. We can get on it right away before it becomes a pathology. And I think that's what something like this does. And then there's treatments involved that, you know, I think we talked earlier about some of the things that from optimizing health. Reoccurrence is about optimizing health, right? So it's all about optimizing your health and your function.
Right.
So your immune boosters, always going to be a high priority, right? And I would say oxygen, huge priority. Mm-hmm. So if you're boosting your immune system, you're oxygenating, you're charging the cells. Mm-hmm. That's Dr. Tennant's work, and we've learned a ton, over the years with listening to him and his research. And that's getting out and even grounding, right? Get your feet on the earth. Let the earth's energy recharge those cells. And then again, we get into cold plunging and fasting and saunas
and all that
detox.
good
Yeah. So
and it's becoming now more and more people
absolutely
are becoming aware, but they're becoming aware though more because people are sick,
sicker.
Not because they want to optimize.
Yeah.
Okay.
Right.
So there's very small percentage of people who are thinking about human optimization and prevention, but
Great
I
point.
want you to think about that first, and that should be, you have to have your health before you have any other goal.
Oh yeah, you can't be a good, say, a husband or a wife or a doctor or a
sister,
employee,
brother,
employer, sister,
child.
brother with functioning at a low level. So that's where a little bit of selfishness can come in, where you take the time and energy, and now you're functioning at high capacity. And that's what the athletes have learned. A lot of the big time athletes have learned.
Yes,
they're investing heavily into their health, and then they're optimizing their performance. They're optimizing their recovery. I always use Tom Brady as an example. I think what he's done has been, miraculous, but it really isn't.
Yeah.
He's just done it the way that it says to do it.
Right.
And then his body recovers, fast, very, very fast. So he's not aging.
Yeah, exactly.
So I think that's, good points overall. So anyway, I'll end with that. I do want to just go back to, let's see, the end here, and I will make sure that you have phone numbers, you have things that you need, because we always get feedback in the morning that we need, you wish we would have went over this. So I want to make sure.
Okay.
So if there's anybody that's looking, that has any type of active disease, right? Right now, cancer, 949-581-4673, the word HOPE. And Vicki is there now. She does a really good job of just listening and steering you and guiding you in the right direction. We have the hyperbaric, right? So remember, some of the top things that, from a health standpoint is oxygen. Hyperbaric's phenomenal with that. So 949-680-1904, or the main number is 680-1880, and then they'll guide you there. Kyle, who's now the director down there, I would call him probably as close to a guru,
Yeah.
you know, in
It's
hyperbaric.
amazing.
He really has a ton of experience and he understands it really, really well. So good hands there. The Perfectly Healthy store, 866-616-7474, and you see the perfectlyhealthy.com. So that's another avenue for you from a supplement standpoint, and if you need to get whatever you need to get, you can take care of it there. And then Miles, if you're looking for the preventative side, or even depending on the time frame, preventing a reoccurrence that you've had years ago. If it is reoccurrence recently, you'll call the Cancer Center for Healing number. But if it's a long time ago, either you're looking for prevention or preventing reoccurrence that happened years ago, 949-680-1880. And if you're not sure, just you can call any of either Miles or Vicky. They'll guide you properly.
Yeah,
we have our guidelines and they'll steer you into the right channel. So there are the numbers. I made sure I got those out. And we want to take the opportunity, as always, to thank you for being here. Thank you for being a part of the movement.
Yes.
Right? That's a critical, it's big. We need to promote this mindset of healing and health and prevention, and addition to the conventional model that's there, because we know there's great value there, right? We don't want to take anything away from the value, especially in the cancer world. But there's just these other chapters of the book that now need to be implemented to optimize or maximize your healing potential.
That's right.
Fair?
That's right.
Final words?
Yes. No, I want everyone to really, we spend a lot of time and energy preparing for our day and for everything, the message we're trying to get out, because we have a true mission to transform the future of health and humanity, because we see that we're in an epidemic of chronic disease and we don't have to, and we want to change that, but we need your partnership to help us do that. So thank you.
All right, everybody. Much love. Okay, we'll see you in a couple weeks. Have a great one. If you need us, just reach out. We'll be happy to help you in any way we can.
Right.
Okay.
Thank you.